Hello everyone, welcome back to Learn English Together. I am Nikki.
And I am Ash. Today's episode is very useful and very important English conversation at the hospital.
Going to a hospital can be a stressful, but speaking English there is even harder.
So, today we will help you understand what to say, how to say it, and how to stay calm. Nikki, do you get nervous in hospitals?
Yes, the smell, the silence, but the doctors are always so kind.
I get nervous when they say, please wait for your turn. The waiting never ends.
Today we will teach listeners all the important hospital English.
So guys, we going to learn importance hospital vocabulary. Okay, let's learn words slowly and repeat after us. First one, appointment. It means a meeting time with the doctor.
Second one, reception means front desk.
Third one, patient. The person who is sick.
Fourth one, doctor, medical professional.
Fifth, nurse. It means helper in the hospital.
Sixth, symptoms, what problem you feel.
Next, fever.
Next one, cough.
Next, cold.
Next one, stomach pain.
Next, blood test.
Next one, prescription. It means doctor's written advice.
Yes, good. Pharmacy. It means medicine shop.
Ward, it means patient room area.
And last, injection. It's very scary. You know all guys. And last one is operation theater.
Okay, Ash, very good. Now, repeat after me, guys, slowly. First one, I want to book an appointment.
Second, I am not feeling well.
Third one, I have a fever.
And last, where is the pharmacy? It's very important words when we visit to hospital. So don't forget and write down in your notebooks guys. So now we learn when we visit hospital. Okay. So Nikki, the hospital looks crowded today.
Yes, let's go to the reception first.
Okay.
Good morning. How may I help you?
Good morning. I want to see a doctor.
Okay. Do you have any appointment?
No, I don't.
Okay, sir. You need to fill this form. Please write your name, age, and symptoms.
Thank you. I will do it. Ma'am, I want to meet the dermatologist.
The dermatologist is available at 11 a.m. Would you like to book?
Yes, please book my slot. Nikki, why do hospital always give long forms?
Fill it slowly. What's your problem?
My problem is my throat is hurting.
Okay, Ash. Right. Sore throat. See? Easy.
Yes, exactly. Now, guys, we teach some useful sentences when we visit the doctor or hospitals. First, when talking to reception, I want to see a doctor. Second sentence, I have an appointment. Third sentence, I need to fill this form. And last sentence, where should I wait?
Now, guys, explaining symptoms. First sentence, I have fever. Second sentence, my throat hurts.
Please, guys, repeat after us. I hope you doing very well.
Okay. Third one, I have stomach pain. Fourth one, I feel weak. And fifth one, I have been coughing for 2 days.
Now we learn when asking for direction. Okay. First, where is the X-ray room? Second, where is the pharmacy? And third, where is the blood test lab? Guys, please repeat after us and write down in your notebooks. Nikki, the waiting room is so quiet.
Yes, Ash, but everyone looks tired.
I hope my turn comes fast.
Patient Ash, please come to room number 4.
That's me. Wish me luck. Okay, guys. So now we learn inside doctor's cabin how to talk with doctor conversation.
Okay, Ash. Hello, Ash. What bring you here?
Doctor, I have a sore throat and mild fever
How long you have had these symptoms?
for 2 days.
Do you have cough or headache?
Yes, I have a light cough.
Okay, I will check your temperature. You have mild fever.
It is serious?
No, don't worry. It's just a viral infection.
Okay, doctor. Thank you. So now doctor writes prescription.
Ash, I am giving you one syrup, one tablet to reduce fever, one tablet for throat pain. Take them after food.
How many days should I take the medicine?
3 days.
Should I avoid anything?
Yes, avoid cold drinks and ice cream. Drink warm water.
Okay, doctor. Thank you. So now guys we learn when we visit medical shop.
Ash, done?
Yes. Now let's go to the pharmacy. Hello, here is my prescription.
Okay, give a minute. Here you go.
How much is it?
260.
Here is the cash.
Thank you, sir.
Okay, welcome. So now guys, a little role play for practice for our listeners.
Okay, listeners, now you practice.
Yes. First, role play talking to reception. How can I help you, sir? You can say, I want to see a doctor.
Second role play symptoms. What are your symptoms? You can say, I have fever or cough or headache.
Nice. Very good, Nikhil. And third one, role play is at the pharmacy. Do you have the prescription? Yes. You can say, yes, here it is. And that's today's full episode English conversation at the hospital.
We hope this help you speak confidently when you visit a hospital.
That's great. And don't
Don't
forget
forget
to
to like,
like,
share,
share,
and
and subscribe
subscribe to
to Learn
Learn
English
English
Together.
Together. Bye.
Bye bye.